Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Becca Rose, who is the owner of Myofunctional Pathways based out of the Sheboygan area. Becca was a dental hygienist for over 20 years, and during her time in that career, she was introduced to a concept called myofunctional therapy. When her son was 3, she began to notice mouth breathing, a setback lower jaw position, and that he was sick a lot, which motivated her to learn more about how to help him and what myofunctional therapy really was. Through the learning process, she actually discovered that her own airway dysfunctions were the reason why at age 28, she had been diagnosed with sleep apnea and prescribed a CPAP machine. Becca became more and more passionate about this newly discovered missing link within her own family's health journey, so she decided to pursue sleep coaching, functional breathing, and myofunctional certifications, and to ultimately help others through this career. It's obvious that Becca practices what she preaches because as of 6 months ago, she no longer needed the CPAP machine she had been using for 14 years. Outside of work, Becca's hobbies include family activities with her husband and 7-year-old son, and expanding her podcast. And if you guys want to check it out, it's called Myo 360, Holistic Solutions for Better Sleep and Better Breathing. If you've never heard of airway or oral dysfunction or myofunctional therapy, you're not alone, but I will tell you that these episodes could literally change your life. You'll hear us, Drea and I, talking about personal experiences within all 4 episodes as well, because our kids and my husband have benefited from myofunctional therapy in the past. And I can't forget to mention that Becca is offering a special discount for our listeners. You can receive $50 off your myofunctional evaluation by mentioning the Motherhood Alliance podcast. In our 4 episodes together, we cover a plethora of areas that myofunctional therapy can help, including mouth breathing, teeth grinding, poor sleep quality, sleep apnea, bedwetting, ear infections, crooked or crowded teeth, TMJ pain, and more. So turn up your volume and let's get started with today's conversation. Hey everybody, welcome back. We are here with Becca Rose again, and we are excited to dive into talking about kids and myofunctional therapy with kids. So welcome back, Becca. We're happy to have you.
Thanks.
So I think my first question is going to kind of circle back to a little bit of what we learned in episode 1, but I want to make sure if you didn't listen to that episode, you have a little bit of background information. First of all, I will say episode 1 was full of information. Definitely go back and listen to that full episode. But Becca, why is bedwetting into later ages or chronic ear infections and ear tubes or crooked teeth in kids, why are all of these things more prevalent in today's age?
The shape of our mouth and jaw has changed over time, over generations, mostly due to the kind of foods we eat. We eat softer foods now, so that doesn't stimulate jaw growth and tongue movement the same way it used to hundreds and hundreds of years ago. So when you're talking about ear you want to start with ear infections?
Sure. Yeah, that's really common.
It is. Yeah. And especially this time of year, right? Most of us know that in kids, the ear tube, I'm just going to say the ear tube so people know it's a hard word to say, but it's smaller. It's a smaller diameter than it is in adults. As we then have smaller structures of our face, that tube gets kinked a little bit more. The interesting thing, though, about the ear infections is that the eustachian tube, I just said I wasn't going to say it, but the eustachian tube, it connects the ear to the throat. And in order for the ears and the tube to drain properly over time, you need to have a correct swallow pattern. This, as an adult, actually changed my life because not only did I have the sleep apnea that we talked about in a previous episode, but I've had sinus surgery and have always had pressure in my ears and horrible allergies. So it wasn't until I learned how to swallow correctly that the pressure in my ears finally went away because I was able to drain the fluid. So you have to learn how to swallow a certain way, contact your teeth, have your tongue in the right spot, and then the ear canals consistently drain. So if you're a child who has their mouth open all the time and they don't know where to put their tongue and they don't know how to swallow functionally and correctly, there's so much more likelihood of that fluid buildup in the ear. And then as it sits there, more bacteria grows and the ear infections come.
So how do ear tubes work? Because that seems to be the most common solution right now.
So the ear tubes help to keep that canal basically from collapsing. But it doesn't always solve the problem. Again, so the ear tubes might fall out, but then the ear infections start coming back. And sometimes they don't. So some kids have them and they're great. They grow, their face grows, they get older, they don't need them anymore. But it's going to prevent that tube from closing in on itself so there is better drainage.
Okay. Can you describe the problem that kids are experiencing that would lead to prolonged bedwetting?
Bedwetting, that's a sensitive topic, but we see a lot of kids, even teenagers and some adults, that still wet the bed on a regular basis. I remember when I was a kid, my little brother wet the bed until he was like 12 or 13. And I remember, because I always had an interest in like the body and biology and things. And I remember my mom saying that the pediatrician told her that the bladder is the last thing to develop fully. And so if the bladder is small, you're going to eliminate while you're sleeping. We know now that there's a huge relationship to breathing. And even the Mayo Clinic recognizes that there's a direct link between breathing, and specifically sleep disordered breathing in children, and bedwetting. Because when you say you're sleeping and you go into a sleep disordered pattern, you start snoring or you have a sleep apnea event, whether you're a child or an adult, your body goes into fight or flight because it can't breathe. And some people, their jaw is going to slide forward. They're going to grind their teeth to open the airway. In other people, the body is going to release urine because as your body's like, hey, hello, wake up, we need to breathe, something needs to happen. And it's more important to the brain to send those signals to empty the bladder so you can breathe than it is to use a pad on the bed to try to wake a kid up to go to the bathroom. And by the time that pad works, they already wet the bed. So, the product isn't helping. But yeah, there's a huge, huge relationship to sleep disordered breathing, sleep apnea, and bedwetting in children.
Wow, that is really interesting. Really, really interesting. And then just to finish out what our title is on here is, so what about crooked teeth? Why are those so common in today's age?
Crooked teeth are a very strong there's a strong connection to tongue posture, lack of tongue posture. If the tongue is down all the time, it's not helping to shape that upper jaw. Then the teeth come in crooked. Years ago, the dentists, and they didn't know better at the time, but they used to take out adult premolar teeth to make room because there wasn't enough room in your mouth for all your teeth. Now we know that you just don't have enough space like for your tongue. So it's not a too many teeth in your mouth problem. It's not enough space in your mouth problem.
Honestly, I feel like that's sometimes orthos still do that.
Some do.
I have heard that.
Some do. There's a push to not do that anymore.
Yeah, good.
Yeah, because there's so many more things you can do now to gain structure and airway space in that upper jaw instead of taking out 4 perfectly healthy adult teeth.
Right. Yeah.
Well, and I find it so interesting that like animals don't have crooked teeth.
Right. Yeah.
So obviously something has changed with humanity, or something is different about humans that we are prevalent to having crooked teeth. So obviously you kind of explained this in episode 1 as well as just a brief explanation there, but it's just so true of how, okay, we have a problem here that needs to be fixed. So obviously there's going to be more things that parents are having challenges with that could be a result of dysfunctional breathing or a palate not being formed correctly or to its optimal position. In other episodes, you've talked about kids being irritable or just acting out. Like that can all be related back to because they're sleeping poorly, which is related back to because they're not breathing well, right? So it's all kind of connected and correlated. What about the chronic congestion piece? So you've kind of tied the nasal passage into this a little bit, but can you explain what is causing chronic congestion?
Most of the time, chronic congestion is a direct cause of chronic open mouth breathing. So mouth breathing. If you bypass the nose doesn't do its job. And the nose is the only organ that is designed to take in air. The mouth, there's nothing anatomically designed to breathe in air. It's an emergency hatch. So if you are bypassing the whole nasal system, all the air you breathe in, it attacks your tonsils, the bacteria, the particles, the viral particles in the air go right to your tonsils and adenoids. That then reduces the airway size and creates some of that nasal congestion. The nose is really a use it or lose it organ. And in order to get its use back, again, you have to learn how to breathe from it. So one of the first things we do in myofunctional therapy during an evaluation is check. We do different things to see, can you breathe through your nose or can you not breathe through your nose? Because if you can't breathe through your nose, like you legitimately can't, there's nothing I can do to help you or any other professional except an ENT or somebody that's going to address the actual structure.
Okay.
But with chronic congestion, if we do a certain types of evaluations during your therapy appointment, I try to determine, is your mouth breathing a real physical necessity because the nose doesn't work, or is it a habit? And it's understood that if you can breathe through your nose for 1 minute, then you can breathe through your nose for life. And now you need to learn how to do that. And that's the number one. There's 4 main goals of myofunctional therapy. Nose breathing is number 1. You have to breathe through your nose for anything else to be effective.
Yeah, and I think the piece that you were just talking about of how the nose is made to filter and clean our air, which is probably leading to a lot of sicknesses, right? Because when we're talking about kids, toddlers are sick all the time. So if you can teach kids how to nose breathe early, they should be sick less.
Yes.
Amazing.
And look at these kids too. I walked into my son's school last year and my mouth dropped. So I mouth breathed for a second. My mouth dropped. But when you look around the school and you look around the kids and you see the amount of mouth open, posture, mouth breathing, look at their eyes. They have dark circles under their eyes. They're not breathing well at night. They're not getting enough oxygenation to their brain. Kids should not have big bags under their eyes. That's a number 1 red flag. If you see that, and also a child's mouth is open all the time, yeah, nose is not going to work well. They're going to be sick. And the other thing about our nose is it makes a gas. I don't know if you guys have ever heard of this. Nitric oxide. No?
No,
Okay.
I have not heard of this.
So quick tidbit on nitric oxide. So the nose is for breathing. The mouth is for eating. Okay. You wouldn't eat through your nose. So I don't want you to breathe through your mouth, right? Our sinuses and our nose cavity makes nitric oxide. And nitric oxide is antibacterial, antifungal, antiviral. And if we bypass the nose when we're breathing and we directly breathe all of that junk in through our mouth, guess what? We're not only filtering the air and reducing some of that intake, but we don't have that extra gas like decontamination of particles and viral particles and bacteria being disabled.
That's really interesting.
I didn't realize that. So this is reminding me of that book, Breathe by James Nestor. Are we going to freak out about that book right now? Yeah, we love that book.
Yes.
It's such a good read, you guys. We should have that in the notes too.
Okay.
Honestly. But that this whole conversation reminds me of that book. I don't remember him saying anything about that, but that is really fascinating. And that just should be enough to say, stop mouth breathing.
I know. And our body does this.
That's amazing.
And that's the crazy thing is all of these things we're talking about, whether it's breathing, nose breathing, nitric oxide, myofunctional therapy, our body does this. Our muscles do these things. We just need to know how.
Wow. So starting at a young age, a baby is born. How can we set them up for success? Like at what age do you come into play? Are there things that parents should be looking out for in the beginning to see signs or symptoms like tongue ties? Can you spot that early? Can you spot nose breathing early in babies? Like tell us more about what can you do starting at the beginning when a child is born?
If a baby is sleeping with their mouth open, that's a first clue that maybe there isn't good airflow or there isn't good tongue posture or airway space. A baby should not be snoring, and some babies snore. And then we look at that little baby and we're like, oh, that's so cute. Look at, oh, no, no. That,
Whoop, whoop, red flags.
yeah, all your flags should be flying if your baby is snoring or your toddler is snoring. But if there's trouble feeding, even bottle feeding, breastfeeding, if there's pain, if they just seem like they can't keep their mouth open, if they're toddlers and they're chewing and there's lack of coordination with the actual chewing process, it's very messy, that might be a good time to reach out to an SLP or a speech language pathologist who has some training in like feeding therapies.
Sure.
Or an airway dentist. Sometimes people reach out. I just had someone yesterday that reached out and asked me, hey, I have a 10-month-old. I know you don't see babies. Do you have someone you can direct me to?
Yeah.
And I did direct them to somebody, which was about an hour from where they lived. So I can do that as well, help direct people. But I typically start working with people at age 4 and up. Sometimes I'll do coaching with parents of toddlers. It's not myofunctional therapy per se, but it's anticipatory guidance. And
Sure.
what that means is we're trying to just get gentle movements started without doing therapy. But then I coach the parent through watch for this.
That's
And
so
then if you
huge,
need more
though.
help, we can try to connect you with someone more specifically trained for that age group.
That's when you're a parent of, a 10-year-old and you I wish I had known that when they were 4 or 3 or 2. And hey, you can, if you have a 2 or 3-year-old, you can talk to Becca and she can coach you through that.
Yeah.
Right? It's amazing.
What about, now this is really has me thinking here. What are your thoughts on thumb sucking and nooks? Because from this conversation, it's like, oh, it keeps the mouth shut so they're nose breathing. Are they good? Are they bad? What are your thoughts on these things?
Nose breathing is good, but the other part, not so good. So a nook should be used very minimally. By 6 months, that should be gone. Finger sucking, I would say by age 2, if they're over 2 and they're still sucking their thumb, it's becoming more of a habit. The thumb and the nook stimulate the roof of the mouth, stimulate the vagus nerve. That's where our tongue should be, right? We've been talking about tongue posture, tongue up on the roof of the mouth. When the tongue is there, that is stimulating the vagus nerve. Vagus nerve is huge for rest and digest and parasympathetic nervous response. When a child gets to be 4, 5, 10, 12, even older, it becomes almost like an addiction. It is so hard for these kids and even adults to break like finger sucking habit.
Really?
Because
Yeah.
now they've been using this self-soothing technique, putting their finger or thumb in their mouth up to the roof of the mouth, stimulating their vagus nerve, getting them, watch what happens with a kid, right? They're panicked, they're crying, they're upset, they're tired. They put their finger in their mouth and they almost instantly calm down.
Just think about that. They're pressing up against that nerve right in that spot.
So the concept is right, where they're stimulating that nerve, but they're using the wrong piece of their body to stimulate it and creating that bad habit. Okay.
The other component is the pressure of that tongue or that nook is putting upward pressure force on the upper jaw, which is going to make the jaw more narrow and more high involted, which is going to lead into more severe myofunctional therapy or myofunctional disorders down the road. And now you're looking at a kid who already had a narrow upper jaw to begin with, and now it's even more narrow. And there's going to be more interventions needed to help grow with like expansion, let's say, to help grow that jaw so they can have adequate airway space. So there's a lot to it.
I mean,
you're gonna
I'm not
blow
gonna
some
lie.
minds.
Yeah,
Blowing some minds.
But it's also hard as a parent because, like, in those moments, so both of my kids were finger suckers. My son sucked his thumb, and then my daughter had her 2 fingers, and they both sucked those until they were a little earlier than 4. So by the time they turned 4, they were done. But it's, as a parent, man, I remember just like when they're crying and they're tiny, and you're just like, please, can you figure out a way to self-soothe? You're almost like desperate for it, but also what you're saying is really important. So I can see how, finding that balance or just knowing that, keeping in the back of your mind that this needs to be a short-term piece is really important, Whatever you're doing as a parent, you're doing things well, you're doing things the best that you can, but just keeping in the back of your mind that it's going to be another transition in the future. We have so many transitions when we have kids.
Yeah, never any shame. Never. If you have that moment where, mama, I'm just so stressed out, and baby is so stressed out and you need that moment, that's okay. But it shouldn't be you plug a pacifier into the mouth as soon as they start making a noise, which is sometimes what happens. And then that habit then becomes habitual and it's hard to break as time goes on.
Okay, so we've talked a lot about common challenges the parents are seeing with their kids and the reasons why they're there. So let's talk about myofunctional therapy within kids. So when families are coming to see you, you're helping them understand obviously all these very awesome basics that we already talked about, but then you're also giving them exercises to work on at home. Now, this is where Drea and I actually come in with some experience here because our kids have also had myofunctional therapy for a few years. I think, how old was Caden when he started originally? Was he like 6 or 7?
Yeah, I want to say he was like, 7, 8 maybe.
So by the time we actually learned about this, our kids were not, preschoolers. They're a little bit older. But I will say compliance with doing the actual exercises has been a challenge for us.
Very much.
So I know you shared in the prior episode about sleep, how you had your own experience with your CPAP and how you've been able to get off of that through myofunctional therapy. And you only had to do exercises a couple times a day for about 5 minutes each. But do you have any tips for us for kids on helping them be compliant with doing these so important exercises?
So the compliancy with kids is going to be very dependent on their age and their abilities to begin with. But generally, you have to be consistent. I mean, and that's the question you're asking is how do we get consistent? But I structure my program for my kids based on where they're at. So if it's a 4-year-old, it's going to be different than it is for a 10-year-old. With a 4-year-old, we might be doing some basic movements, 1 or 2 of them for a couple of months. And then we might not meet again for 4 or 5 or even 6 months. Other kids that are older, I want to see them every 2 weeks. And I'm going to give them 3 to 4 exercises to do. And it equals about 5 or 6 minutes twice a day. Some of the time you can do those in the car. And some of the times I need the kiddo to watch themselves in the mirror.
Sure.
And we come up with reward systems. And I am always in contact with my kids. And sometimes we'll send videos to each other through different apps on the phone. I send the videos and that helps keep them encouraged. That helps keep them motivated because they know.
Accountable. Accountable other than their parents.
Yes, because they know they're going to see me again in 2 weeks and we're going to hop on the computer and we're going to have a Zoom call in most cases. And they know that they're going to see me again on this day. And then they can look at their parents' phone anytime they need to see that, oh, I forgot. Or the parents pull it up and they're like, remember, you're going to see Becca. So it's not like a scare tactic by any means, but it really helps keep them accountable. And we just have to be consistent with it. So that's what's nice about like a structured program for kids.
So if a parent is proactive, they're hearing this and they're like, oh my goodness, this could be a ticket for us. And they started doing myofunctional therapy. Could this really lessen the chances that their child will need braces in the future?
There's a strong likelihood. Yeah, we do something called a swallow test. And the swallow test, I wish we had more time. We could go through it and let the audience do it along with us. But we want to make sure that they don't have a tongue thrust too.
Let's bring that into the next episode.
Sure.
That would be awesome. Yeah, so let's bring in, so guys, in the next episode, we're going to actually have Becca walk us through that. But you can finish your explanation here as well.
Okay. If a child can habituate a correct tongue posture on the roof of their mouth and keep their lips closed, they're going to have a natural force helping to shape the teeth as they come into place. So it can't always completely eliminate the need for braces. And if braces are still needed down the road, it may not be as complex of a case because maybe the teeth are just a little crooked instead of one tooth is growing down the middle of the roof of the mouth because there's no room for it to go. So yes, getting those muscles working correctly, functionally, right from the start definitely reduces braces, likelihood of braces or time in braces.
Okay. And then one more question related to kids specifically is that we've also seen on the market and heard about like the different types of mouth guards for kids that also kids can wear at nighttime or even daytime use, but they help to like lead the teeth into certain slots. Like what are your thoughts on those? And do you offer those through your practice, or what are your thoughts on those relaying into myofunctional therapy?
So those kind of devices that help guide the teeth, I cannot do those. Those need to be prescribed by a dentist or a doctor. I know what kind of devices you're talking about, and I think that they're good in some regards. Sometimes you can connect with companies that will guide you through it online and they'll send you them. I don't feel like that's as successful as if you find a doctor who actually you can go see in person. I feel like they need to be directed by a doctor. There's other devices that I can offer that are more of chewing devices that are going to help to activate the mid-face muscles. And those muscles don't get a lot of action, again, because we don't chew very much like we used to. They're a great thing, but there's a lot of issue with compliancy. Many kids don't wear them. And if they can't breathe through their nose, they're going to pull them out. They're going to push them out. The parents get upset because they're not keeping them in at night. And I spent $3,000 on this thing. And why aren't they using it? If they can't breathe, they're going to push it out. If their tonsils are too big, they're going to push it out. So there's a lot of compliances. I would definitely advise working with a dentist or even a myofunctional therapist who can help guide them in making sure that they can do the functions they need to make that work the way it needs to.
So if somebody's looking in between, like if somebody knows that their kid is having issues sleeping or having any of these troubles that we're talking about, obviously they have a choice. They can go to an airway dentist and get that device and maybe do their exercises, or they can go to someone like you and you can do exercises with them. Which one would you like advise? Do you think that like they should do some myofunctional therapy first, then the device, or both? I mean, it's individualized, obviously, but.
And I think another way to ask that question is, can you get the results that you need and can you see the changes that you're looking for by myofunctional therapy on its own? Or do you also need a device too? Or should you both?
Yeah, that's what I'm asking.
You should have both.
Okay.
People think that a device is going to solve all the problems. It doesn't matter what the device is. If it's, a brace for your leg or it's something for your mouth, you're clenching and grinding. They feel like a device or a product is going to fix the problem. Most of the time, it doesn't by itself. So if you're putting the device in and that's all you're doing, okay, yeah, you might get some guidance of the teeth. You might get some growth guidance. But then once you take the device out, if the muscles are dysfunctional, you're more than likely going to have some retraction of the benefits that were gained from using the device in the first place. On the other hand, some kids who are going into fixed expansion or like a Vivos or a removable expansion device, I'll see them 3 or 4 times before they put that in, and their compliancy with the device is astronomical. And I have a dentist in the Milwaukee area who's actually referring to me for that specific reason. Hey, we're going to put Johnny in an expander. He's 5 years old. We want to do a few expansion or a few myofunctional therapy appointments first so he knows what to do with his tongue. So when he puts that device in, he already knows how to swallow. Yeah. So the tongue gets confused and it's hard to chew and it's hard to swallow. It's making a huge difference. So the answer is both.
Okay. No, that was very good and clarifying, because I feel like that is a piece that I'm starting to hear more and more amongst friends groups is the devices, but like, how does that relate to the exercises? The way you explained it was really awesome and clear. And just so that you guys know, you guys can contact Becca through her website. She would do a consultation with you and just help answer any of your questions. What is your website again, Becca?
Myofunctionalpathways.com.
Okay. So if any of this piqued your interest, feel free to reach out to Becca. Let her know that you heard about it on the podcast, and she would be happy to answer your questions. We'll see you guys back in the next episode. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.